You know that feeling when you leave a doctor's office and you just feel like they didn't get the whole story? Like they only heard a tiny piece of what's really going on? Yeah, that frustration is super common. Today, we're going to dig into why that happens, and more importantly, how a new way of listening is starting to change all of that. I mean, really think about it for a second. The biggest decisions about your health, about your treatment, are being made based on what feels like just a tiny snapshot, right? A few minutes in an exam room. Does that really capture the full picture? And this, right here, this visualizes the problem perfectly. Our health story is basically split in two. You've got that tiny 3% slice. That's the time you're actually in the clinic. But then there's the other 97%. That's your life. That's what happens at home, between those appointments. And that's where the real story unfolds. So here's how we're going to walk through this. We'll start with the 3% problem. Then we'll dive into life in the 97%. We'll talk about why our system is always looking backwards, then shift to a new way to listen. We'll get into how it actually works, and finally, what a proactive future could really look like. Okay, so let's talk about that 3% problem. That doctor's visit, as important as it is just one single moment in time. It's like one frame in a feature-length film about your health. And you know what? It almost always misses the most important scenes. So what about the rest of the movie, the 97%? This is that huge, unseen part of our lives. It's where symptoms can subtly change, maybe medications get missed here and there, and honestly, it's where the first real warning signs of a crisis start to show up. And this picture just captures that feeling perfectly, doesn't it? For so many patients, and for the families who are right there with them, this whole journey can feel so isolating. You're the one living with it day in and day out, and it feels like the healthcare system just isn't seeing what you see. So what exactly is being missed? Well, it's all the subtle stuff that really adds up. It's those small behavioral shifts that might point to something deeper. It's the missed pills that, quietly start to accumulate. It's the stress at home, the things that only a family member can see, those early signs that something is wrong. It's that slow, gradual decline that's almost impossible to spot in a 15-minute checkup. Now, here's a really crucial point. This is not our doctor's fault or our nurse's fault. They're doing the absolute best they can. The problem is the system itself. It's designed to be reactive because it's always looking in the rearview mirror. Just look at this timeline. It's kind of wild. So let's say a health survey is done in 2024. Then for 2 years, life just happens. Health can change a lot. By the time another survey is done in 2026 and all that data gets processed, the system is only just now seeing a problem that started 2 full years ago. Any chance to get ahead of it is long gone. Okay, but what if we could change that? What if we could just stop looking backwards and start seeing what's happening right now in real time? What if we could finally, turn on the lights in that 97%? And that's the whole mission behind OutsideINsights and its founder, Jeremy Ryan. Now, he's not some tech guy from Silicon Valley. This is someone with 30 years of experience on the front lines of emergency medicine and crisis intervention. He's seen the devastating results of this blind spot over and over, and he decided to build something to fix it. So you might be thinking, okay, this sounds great, but how does it actually work? It must be some complicated new system, right? Well, actually, no. The real beauty of it is how incredibly simple and accessible it is for everybody. It really just boils down to these 3 steps. First, you capture the signals. Patients and their families just share simple updates, often with a quick text message. Second, you surface what matters. Smart technology looks at those updates, and it picks up on those subtle shifts, those early warning signs. And third, you deliver the insights. That important info goes straight to the care team in a way that just fits right into how they already work. And the secret sauce to capturing those signals is the care circle. This is so powerful. It's not just about asking the patient how they are. It's about empowering the people who see them every single day, a spouse, a caregiver, a physical therapist, to share those simple but game-changing observations like, Dad just seems worse this week. That simple story gets turned into real, usable data. And here's maybe the best part of all. There's no app to download, no new logins or passwords to remember. This just gets rid of the biggest roadblock with technology, especially for older adults. It makes it easy for everyone to share their story. So when you put all this together, what do you get? Well, you get this fundamental shift. We move away from a system that's all about crisis care, just waiting for things to go wrong, and we move into a new world of continuous care. And this chart just lays it all out. Reactive care waits for a crisis. Proactive care helps prevent one. Reactive care relies on old, stale data. Proactive care uses what's happening right now. In the old way, family is on the outside looking in. In this new model, family is a crucial part of the team. It is the difference between feeling unheard and feeling like your whole story is finally being heard.
So, let me just leave you with this one question. What if your healthcare wasn't built around that tiny 3% in the clinic? What if it was built around the other 97%, around your whole story? Imagine that. It's a future where we can actually prevent suffering, improve lives, and finally feel truly seen.